Hi everyone, welcome to today's webinar on racial trauma in communities of color. My name is Emily Scahill. I'm the Manager of Public Education and Awareness at MHA's National Office, and I'll be moderating today's webinar. Some notes before we get started today. All participants are currently muted and unable to turn on their microphone. We are recording this webinar, and I will send the recording and slides out to all registrants within the next week. And you'll also be able to find them archived on MHA's website at mhanational.org/MHA-webinars. We do not offer CEUs, but if you'd like a certificate of attendance, we have a form for you to request one. I will post the link to that form in the chat, and it will be included in the follow-up email as well. And last but not least, we've built in some time for a Q&A at the end. So post your questions in the chat box throughout the presentation, and we'll go through some at the end, and feel free to make comments as well or share some of your knowledge in the chat box too. And now I'm so excited to introduce today's speaker, Dr. Stephen Kniffley. Dr. Kniffley is Spalding University's Chief Diversity Officer and an Assistant Professor in Spalding University's School of Professional Psychology. His area of expertise is research and clinical work with Black males and the treatment of race-based stress and trauma. Dr. Kniffley also serves as an organizational diversity consultant and works with law enforcement departments on addressing conflicts between communities of color and police officers. Dr. Kniffley has written numerous books, book chapters, and articles on Black male mental health, Black males in the criminal justice system, and academic achievement. Additionally, Dr. Kniffley was recently selected as one of Louisville's top 40 under 40 for 2020, as well as a recipient of the 2020 MediStar Healthcare Advocacy Award. We're so excited to have him with us today, and now I'll turn it over to Dr. Kniffley to get us started.
All right, good afternoon, everybody. So I'm so grateful to share this platform with you and to share this space as we learn a little bit more about the impact of racial trauma on communities of color. So just a little bit about myself. I certainly appreciate the introduction. Just want to highlight a couple of other things. So I'm the Chief Diversity Officer for Spalding. I do run what is known as the Collective Care Center. It is one of very few racial trauma clinics in the entire U.S., and we provide free and accessible service to those folks that need it, as well as training and community education opportunities. I don't ever start any presentation without paying honor to those folks that have paved the way for me to be here. And so you will look to your right, there's a picture of myself with my papa, who without people like him and my grandmother and my parents, would not be in this space sharing this time with you. And so I always am thankful to them. So I was able to do a TED Talk on how do you have conversations with folks that are different from yourself in terms of having good cultural communication. A couple books that might be helpful to share here. One is on Black male mental health and how do we support Black males that are struggling with mental health issues. The other one is a book on Black males in the criminal justice system and finding ways to explore how we can navigate the process from arrest to reentry for those Black males that have become criminally justice involved. One other thing to note here is that I run a blog called The Afrocentric Psychologist, where we explore issues related to Black folks in regards to education, mental health, healthcare, social justice related issues, criminal justice issues, etc. And we'll encourage you to check that out. So my goals for our time today, and then I'm certainly open to hear about your questions and to support you any way that I can there, is to provide definitions for racism and microaggressions, because we know that those impact the experience of racial trauma, defining race-related stress and what that experience looks like for Black and brown folks, exploring how racial trauma impacts folks from a psychological and also from a physical health standpoint. Then I would like to just briefly introduce the model of therapy and assessment that we use at our Collective Care Center to support those folks that have experienced race-based stress and trauma. So I just want to start the presentation by sharing with you a little bit about what has inspired me to do this type of work as a way to help center our conversation in regards to how we can support those folks that have experienced race-based stress and trauma. So I've been very fortunate to travel all over the world, and two places that have always been near and dear to my heart are South Africa and Senegal. Senegal is located off the western coast of Africa, and also during my time in South Africa, I was able to gather a couple of terms and ways of thinking about the world that really influenced how I think about the treatment of racial trauma and race-related stress. The first one here is this philosophy of Ubuntu. And essentially what it refers to, or is reflected in this African proverb that says, I am because we are, and we are because I am. And what it refers to is this idea that sometimes when we experience racial trauma or race-related stress, we feel isolated and we feel alone, like no one understands us and no one really gets our experience. And so by channeling this idea of Ubuntu, it helps us to remember that we're indeed never alone and that there are those out there that share our experience and are willing to share in the pain and suffering with us. Another term that I learned during my time in South Africa was Sawubona. Sawubona is a Zulu greeting that essentially means I see you. I'll see you. And what that kind of translates in terms of thinking about racial trauma and racial trauma therapy is this idea that for many Black and brown folks, racism and discrimination has caused them to either be unseen, if you will, or to only be seen for a certain part of who they are based on the projections that society has placed on them. And so if we're looking to support those folks that have experienced race-based stress and trauma, we can help them to feel seen and to be seen for their authentic selves and not for the narratives that are oftentimes placed on them. Another term here is this idea of Sankofa. So Kofa is all about looking back in one's history. And if you'll direct your attention to the center of the screen there, you'll see a picture of myself standing in a doorway. This door is called the door of no return, and it is connected to a slave port or slave fort off the coast of Senegal. So slaves would be marched across Western Africa, and they would be marched through this door to board the slave ships to then be transported to various parts of the world. And what these enslaved folks knew is that as they were walking through that door, that they would most likely never see their homelands again. And so the reason why it's important for us to reflect on our history and to make sure that is a part of our understanding with racial trauma is because I believe that my ancestors knew that one day one of their descendants would walk through that door again, having returned to perhaps our ancestral homeland. And so I believe that kind of gave them the resiliency and the strength to make it through slavery, to make it through Jim Crow, Black codes, the struggles of the civil rights movement, to produce the Black doctor in our particular family. And so when we're supporting folks that have experienced racial trauma, it's important to remind them that their history exists outside of just the slave narrative, and then also the narrative connected to the civil rights movement. So although those are important points in our history, it is not our entire history as Black and brown folks. And so it's important to remember that there was a history before those things, and there will certainly be a history after those things as well. The last piece to think about is this African proverb that says, if you conquer the enemy within, the enemy without can do you no harm. And if we think about the challenges that Black and brown folks are facing, many of it has to do with this idea of internalized racism. So we have taken the tools of the oppressor, if you will, and we have imposed those tools on ourselves, and we have sought to impose those tools on other Black and brown folks as well in the form of colorism and other forms of prejudice. And so what we can do is we can support Black and brown folks that have experienced race-led stress and trauma by helping them to conquer the enemy within in the form of internalized racism. And so just kind of by tying all of these together, we can support folks that have experienced racial trauma and race-related stress by reminding them that they are not alone, by seeing them for how they wish to be seen as authentic in terms of their authentic selves, by reminding them of their history and how their history is connected not just to oppression, but also to thriving as well, and also to help them to conquer the enemy within in the form of internalized racism. And so you might be wondering, well, why even have this conversation around racial trauma? How is this different from other forms of trauma that other folks might be experiencing? So there's a couple of stats I would like to highlight here. The first one is that 96% of Black Americans are reporting daily experiences of racism and discrimination. This has had a significant impact on the mental health of Black and brown folks. Specifically here, the rates of depression for Black males has quadrupled in the last 2 decades, leading to suicide now being the third leading cause of death for Black males across the lifespan. One would assume that having access to education and then also financial resources would serve as a buffer against the experience of racism and discrimination. But there's significant research suggesting that actually it does not provide the buffer that we would expect. So, for example, here in the city of Louisville, folks that live in our West End area, which is where our predominantly Black folks live, have about a 12-year less life expectancy compared to their white counterparts that live in East Louisville. I myself, who identifies as a Black man, will live about 10 years less compared to my white counterparts who have the same level of education, same access to financial means, for no other reason than, the different experiences that we will have or have had based on the color of our skin. Also, there was a study that was done that examined how high-earning Black women are at risk for giving birth to low birth weight babies, just the same as low-earning white women who have less access to education and financial resources. And so there's something going on that centers race as something that impacts low birth weight and then also life expectancy. Lastly, here, the Center for the Study of Hate and Extremism found that hate crimes are at their highest level in a decade, with African Americans being the most targeted group, which suggests that due to number of hate crimes, Black individuals are the most hated racial group here in the entire US. And so if we take these statistics together, objectively, due to the number of hate crimes, Black individuals are being deemed the most hated racial group. Subjectively, many Black Americans are reporting daily experiences of racism and discrimination, and that these have had a significant impact on the mental health of various types of folks of color. And one would expect that one's financial access and one's educational access would provide a buffer against these experiences, but the research is suggesting that that is not the case. And these are reasons why it's so important for us to talk about racial trauma, because there's something unique and different about the experience of Black and brown folks when it comes to racial trauma that is having a negative psychological and physical impact on them. And so I just want to make sure that we're all operating from the same definition when it comes to racism. And so just remind ourselves that racism is that use of power and privilege at three levels: the individual, institutional, and cultural levels, that is designed to oppress folks based on perceived biological inferiority characteristics. And one is further oppressed based on their adherence or not adherence to dominant cultural standards in regards to hair texture, in regards to lightness of skin, and other dynamics related to one's culture. So the research has been pretty clear that the mechanism that contributes to a large amount of race-related stress that Black and brown folks are experiencing is due to something called microaggressions. Microaggressions are commonplace verbal, behavioral, environmental indignities that can be intentional or not, that are really designed to communicate negative or hostile racial slights towards people of color. There are three different types of microaggressions. There are micro-insults, micro-assaults, and micro-invalidations. When it comes to the experience of race-related stress, micro-invalidation is also known as gaslighting, are probably the most helpful thing for us to think about. And these are communications that are used to exclude, negate, or nullify one's experience in terms of their thoughts and feelings based on being a person of color. Some examples of microaggressions are saying things you are like you're a credit to your race, or why are you people so loud, which are known as micro insults. And then micro validations such as I don't see color. If you don't like it here, go back to your country. We're all a melting pot. We're all Americans and everyone can succeed if they just work hard enough. But while these messages seem well meaning and well intentioned on the surface, what they fail to include is that there are systems that are actively working to create spaces that are difficult for persons of color. So it's not just as easy. So many of these messages either deny the lived experience of Black and Brown folks, or they erase the difficulties connected to their lived experience. And so the difficulty with microaggressions is that the first time you experience a microaggression, it will come as a shock, but you're able to utilize your coping strategies. You're able to advocate for yourself. You're able to educate the individual about why what they said or did was wrong, or you're able to seek out other forms of help and support. But just like the muscles in our bodies, the more you use a certain muscle without rest, the more that muscle becomes exhausted. And that's where the use of the exhaustion or adaptive coping strategies can come into place. And when those muscles, when that adaptive coping becomes exhausted, that's where we start to experience that race-related stress. And so there are a couple of different types of race-related stress that we could consider. Probably the most helpful one for us to think about in this space is what is known as vicarious racism. So we're living in a social media age, which means that we are constantly connected to the news and to one another, which means that when things happen in our country, when things happen in our world, we have it at the tips of our fingers to be able to access the information. And oftentimes, we spend a significant amount of time viewing that information. And so, if we think about over the last year, various forms of police brutality, various forms of harm that have come to Black and brown bodies, we've been constantly exposed to those images in our social media, in the news, within our conversations with others. And this is what vicarious racism is, where we have to navigate the racist experiences that other folks have while we witness those things or those events. We're also navigating our own experiences of racism and discrimination as well. And so it's kind of like this double experience of racism and discrimination that we encounter that causes us to experience race-related stress. And so one might wonder, well, how is race-related stress different from other types of stress? And just want to highlight three areas in which there is some uniqueness. The first one here is the chronic nature of race-related stress. So there are other forms of stress that we might experience throughout our lives, but there are not that many types of stress that one might experience from the time that they're born, really, until the time that they die, that is also passed down generationally as well. And that's one of the ways in which race-related stress is different from other forms, is that it's stress that transcends time, and it's also stress that is a part of our narrative as Black and brown folks that we can't get away from oftentimes. Another thing to think about is that race-related stress is different from other forms of stress due to the systems that are actively working to create that stress for Black and brown folks. So for example, I could experience uh, stress as a graduate student. I could experience trauma because I got into a car accident or something along those lines, but there are not systems actively at play across our education system, across our criminal justice system, political system, et cetera, that through both legal means, cultural means, et cetera, that are designed to create difficulty for persons of color that lead to that race-related stress. And so like that's why that socio-historical emphasis is so important for us to think about. And the last piece is the ambiguous nature of microaggressions and how that in fact impacts the influence of race-related stress as well. Because although microaggressions are harmful and they can really cause difficulty for many folks, it's real hard to touch a microaggression, because the perpetrator of the microaggression is always able to deny the lived experience of that person of color, as well as to deny their complicity in committing that microaggression. And so it's left then up to the recipient of the microaggression to interpret, to advocate, and to cope for themselves when they experience those microaggressions. And so the ways in which race-related stress is different from other forms of stress is the fact that it's chronic in nature, it's ongoing, it's rooted in multiple systems actively working together to create difficulties for Black and Brown folks. And it's also centered around this ambiguous nature connected to microaggressions and the ability of folks in a dominant culture posture to be able to deny the lived experiences of Black and Brown folks. And so what this does is this this creates a cycle where one experiences microaggressions, one's adaptive coping strategies become exhausted, which means that they become more stressed out based on their race, which then means that they're more vulnerable to the experience of racial trauma. Because of that limited adaptation of coping strategies, they're witnessing all the things that we're seeing in the news. They're experiencing their own forms of racial trauma, which causes them to be more hypervigilant for microaggressions and further increasing their race-related stress and then subsequent vulnerability to racial trauma. And so when we think about this idea of racial trauma refers to these elevated levels of trauma, of PTSD that can't be explained by exposure to physical trauma. And so this trauma then is the result of chronic experiences of racism and discrimination that create that constant state of hypervigilance for microaggressions at the individual, institutional, and cultural levels. Over time, our ability to cope becomes exhausted, which leads to those negative health outcomes that are caused by race-related stress that we'll talk about in our next slides. So when it comes to the impact of racial trauma, it's important to focus on not only the psychological impact, but also the physical impact as well. And so if we think about the psychological impact, many of these terms are familiar for folks if they're have an understanding of PTSD in regards to the experience of flashbacks, nightmares, and intrusive thinking, inability to concentrate, hyperactivity, and also what is known as alexithymia or restrictive emotional expression. As a child psychologist, I always like to draw attention to that inability to concentrate and hyperactivity because for many of the folks that come to hang out with me, many of them are being referred for ADHD-related symptoms. And so one of the things I always try to do as a mental health professional is make sure I'm doing a good job of assessing not only for ADHD, but also for the experience of trauma as well, knowing that that can mirror or mask potential trauma-related symptoms. The other thing to think about is someone who works a lot with angry boys is that if we think about what alexithymia and what trauma can do to a person's ability to emote, it can limit and restrict your ability to engage in meaningful emotion expression. It also can limit your ability to see a full array of emotions in the people around you because folks can literally lose their ability to understand and then also to be able to identify, be able to express their own emotional experience. And if I think about the young guys that I work with, many of who have experienced trauma, specifically racial trauma, they utilize the most accessible and most socially accessible emotion, socially accepted emotion, which is anger, because they have literally lost the ability to communicate other parts of their emotional experience. So when it comes to the biological impact, there's this hormone in our body called cortisol that helps us to fight, flight, or freeze in dangerous situations. And in the appropriate kind of sequence of things, the cortisol rushes in our bodies. It helps us to address the dangerous situation. And then it dissipates from our bodies, and we're able to go back and resume our normal lives. However, as I mentioned before, um, Black and Brown folks, due to the constant experience of racism and discrimination, and the subsequent experience of racial trauma and race-related stress never really feel their bodies going back to, in quotes, a normal space, which means that for many of them, they're experiencing higher levels of cortisol at all times compared to the general population. The research has been pretty clear that having too much cortisol in your body can lead to negative health outcomes in regards to decreased immune system, hypertension, fatigue, migraines, acid reflux, insomnia, etc. There's also been research to show that this biological impact can be passed down through the generations, where a mother can pass down similar cortisol levels to her children. Also, there's been research to suggest that the experience of racial trauma can influence our gene expression. So there was a study that was done that examined this experience of breast cancer in Black women who can experience a more aggressive form of cancer. And what they found is that those women who also reported experiencing racial trauma were more likely to develop this form of cancer, this form of breast cancer, compared to those folks that did not have the same type of racially traumatic experience. And so excessive levels of cortisol in the body can lead to negative health outcomes. Those negative health outcomes can be passed down through the generations. And also, racial trauma can literally change one's gene expression in their lifetimes. So what happens here, this is just a trajectory of encountering that race-related stress, experiencing that excessive cortisol, developing poor coping behaviors in order to address the symptoms that go along with excessive cortisol, like our heart racing, constantly feeling anxious, things along those lines, which could lead to substance use and other maladaptive behaviors. This can also lead to changes in our gene expression as associated with forms of cancer, which ultimately kind of coalesce to create these negative health outcomes that we've been talking about. So I just want to highlight what racial trauma can look like for folks in a couple of settings, from education to housing, and then also to public safety. So for our youth in the education setting, many of them are coming into spaces with trauma-influenced behaviors and emotions. And this could look like hypervigilance, aggression, irritability, poor decision-making, and various mood-related issues. And so we, as instructors, have a choice. We can either ask the question, what's wrong with you? Or we can ask the question, what has happened to you? And when we ask the question, what is wrong with you, that can contribute to biased and informed perceptions, which lead us to having lower expectations for achievement, one's capacity to emotionally regulate, social skills, and then also decision-making abilities. However, it can also lead to higher expectations for deviant behavior, aggressiveness, and then also learning challenges. Whenever we take that what is wrong with you perspective, that can also lead to the use of punitive disciplinary practices where we just seek to contain the kid and their behavior rather than teaching them skills that are needed to manage their trauma-influenced behaviors and emotions. This can then contribute to a disproportionate use of suspensions and detentions. It can also exacerbate the experience of race-related stress and other symptoms of racial trauma. When it comes to racial trauma in housing, for many folks, due to gentrification, redlining, and other forms of housing discrimination, adverse housing policies have been developed, which can contribute to a decreased access to quality health, education, and economic resources, which ultimately can influence increased risk for race-related stress. And these can kind of cycle on one another, where one encounters those adverse housing policies, leads to a decrease in health and economic resources, and then increases that risk for race-related stress, and the cycle can continue from there. In regards to racial trauma and public safety, there's an ongoing conversation within communities of color about the function of policing versus the process of policing, specifically around this idea of procedural justice and police legitimacy. And here, procedural justice implies or refers to, will I encounter the same type of treatment as a white individual perhaps might encounter when we have engaged in the same offense or have experienced the same type of stop. And so the researchers found that those folks that, when they have encountered, um, when they've had interactions with law enforcement officers, where they felt that those experiences were procedurally just, they were less likely to have racial trauma-related symptoms. However, when folks were involved in situations that they did not feel were procedural just, then they were more likely to encounter and experience those race-related stress and trauma symptoms. And this was irregardless if the situation ended in the way that they had hoped it would. And so just want to highlight here that we have our clinic here in Kentucky called the Collective Care Center, where we provide free and accessible services to those folks that need it, as well as training and education for community members and also clinicians. We, to date, are training over 400 clinicians on our model of racial trauma therapy. This year alone, we've seen over 100 clients in our clinic and have conducted 130 or so community presentations in the last year alone. Our clinic is award-winning. As was mentioned before, I was a recipient of the Healthcare Advocacy Award for the work I've done around racism and discrimination and supporting folks that have experienced racial trauma. We were selected or nominated for a Healthcare Education Award for our racial trauma therapy curriculum that we train clinicians in. And then I was recently selected as a healthcare hero for the city of Louisville for the work that we're doing in supporting folks that have experienced race-based stress and trauma and making sure to provide quality education and training, but then also accessible resources and services for those folks that need it. So when you think about who is eligible for our mode of treatment when it comes to racial trauma therapy, they have to meet 4 criteria. They have to be someone that has experienced a traumatic situation that they attribute to their racial background. They have to report experiencing significant race-related stress, and then also significant discriminatory events, however they choose to define that, as well as reporting a low racial identity development based on the measures that we use. And then, of course, other forms of trauma-related symptoms, such as those flashbacks and nightmares, intrusive thinking, difficulty concentrating, hyperactivity, and then also restrictive emotional expression. So the objectives of our approach to racial trauma therapy are to support the individual in developing their racial identity, providing space to process experiences of racial trauma, and then also building and practicing skills for future racially traumatic events, knowing that although we will give space to process and develop, that as they walk out our doors, that they will most likely encounter other forms of racism and discrimination. So we have to equip them and help them to be prepared for those difficulties ahead. Our model follows a 12-session format where we spend 4 sessions helping an individual to develop their racial identity, providing space to process racial trauma in the next 4 sessions, and then also developing skills for future racially traumatic events as part of the last 4 sessions of the treatment approach. And so I wanted to make sure to leave as much time as we can to do some questions and answers. So you have my website there. It's drstephenkniffleyjr.com. You also have my email address, sniffley01@spalding.edu. I'm also on Instagram, and we'll certainly welcome you to be in that space so you can keep up with the things that I'm doing, as well as the resources and information that I'm providing. So I'll be happy to take any questions that folks might have, and thank you for your time and for being in this space with me.
Great, thank you for such great information. Yeah, we do have a good amount of time for questions now. So as I said, everyone, you're welcome to ask questions in the chat box. and we do have some to start with. So what assessment tool do you use to assess for trauma?
Sure. So we utilize what is known as the RBTSSS, was created by Carter and colleagues, and it is called the Race-Based Traumatic Stress Symptom Scale. And what it does is it looks at how someone has been impacted by trauma in regards to symptoms such as hypervigilance and intrusion, depression, anxiety, anger, etc. And so we utilize that tool to be able to assess for the experience of racial trauma.
Great. And what about assessment processes for differential diagnoses regarding ADHD and racial trauma?
So it's being mindful, especially with our youth, to because we do not have good racial trauma measures at this point, to make sure that we are incorporating trauma assessment tools like the trauma symptom checklist for kids or for children, as well as utilizing our basic ADHD scales. Specifically, like to utilize performance-based scales like the CPT or the Connors or somewhere on those lines. Um, but making sure that you're including questions around trauma, and then making sure that you're including structured assessment tools for trauma, like the trauma symptom checklist for children or other forms like that.
Great. And what modalities do you use for trauma processing?
So our racial trauma processing follows a three kind of sequence format. Um, Similar to like a CPT or other forms of trauma processing, we encourage the client to think about and reflect on the narrative connected to their experience of racial trauma. But we also take the third step, which is to help the client to depict a differing outcome, right? So their ability to show their resiliency, their ability to show that they've overcome that situation. I feel that we spend so much time reflecting on what has happened that we don't reflect on what could be for the client. And so we also spend time as a part of the racial trauma processing, exploring that experience. So having the client write the narrative, having the client process the narrative, but then helping the client to create a co-narrative, which includes components of resiliency and overcoming.
Great. What are some specific examples of healthy coping skills or behaviors that you teach to help people experiencing racial trauma that are currently using maladaptive coping mechanisms?
Absolutely. So there are two kind of main skills that we're teaching. The first one comes from Sue and colleagues that focuses on what are called micro interventions for microaggressions. And so we teach folks how to educate the offender um, about how what they said it did was wrong. Well, we teach them about how they can make the invisible visible in terms of reducing the ambiguity of microaggressions. We teach them how to disarm the microaggression utilizing their assertiveness skills. And we also teach them how to educate folks. And well, how to seek out affirming spaces. And then there's this tool created by Stevenson and colleagues that is called racial literacy. And racial literacy is helping folks to accurately identify a situation as racist, to accurately identify the coping skills that they can use that are adaptive, and then to be able to assess if they were able to accomplish um, what they had hoped to in terms of navigating that racist situation. And this is a little different from what are known as racial legacy messages, because those are messages that say things like you have to work twice as hard to get half as much, and really communicate that things are going to be hard for us out there as Black and brown folks. But it doesn't really tell us what to do about it when we encounter those hardships. And so racial literacy skills are what we're teaching, and then also those micro interventions for microaggressions.
Great. Let's see. How do you work with those who are currently experiencing trauma while also building resiliency to function in the world that we live in simultaneously?
Sure, no problem. So that's why we follow our sequence of racial identity development to then racial trauma processing, because you can't really support folks in terms of the processing of the racial trauma until they first feel like they have an affirmed racial identity to stand on. The research has been pretty clear that having a meaningful racial identity is a good coping skill to be able to process and deal with instances of racial trauma. And so we would help the person to develop their racial identity, to make sure that make sure that identity feels affirmed for them, and then move into the space of processing the racial trauma.
Great. How would you address a client who denies any experience of racial trauma?
Absolutely. That's why we have there's a two kind of part answer there. The first one is to think about what is known as false psychological consciousness. And as a part of that, it helps us to think about how denying parts of our experience and the things that have happened to us could be a method of control. It helps us to navigate situations where we otherwise might feel powerless and helpless. And so if I'm working with someone that denies that they've experienced racial trauma, I'm going to reflect on the why. Why are they doing those things? And a lot of it has to come from a protective factor, right? So if I had to acknowledge that there were systems out there that were actively designed to make things hard for me, then I'm gonna feel helpless and hopeless in that situation. And so denying those experiences helps us to do that. And so like that would be a space where I would develop some empathy for the client and help them to process what that might look like, because maybe you don't have to feel helpless if you know that you can do something about the systems that you're in. And then the other piece is to use our more objective measures. So Williams and colleagues has a measure called the Daily Life Experiences Scale, and that helps us to navigate asking the client questions about any sort of discriminatory experiences that they've had. Because for many Black and brown folks, because we experience the same thing so often, we start to think that they're not racially traumatic because it just happens so much to us. And so if we actually have to put it on a piece of paper and say, this has happened to me, that could bring it to our attention, and we can have some dialogue around it. So empathizing with the client, and then also utilizing objective tools such as the Day Life Experiences Scale.
Great. And could you talk a little bit more about that racial identity development and the work that you engage in during those first four sessions?
Absolutely. So we first do an assessment. For Black folks, we utilize what is called the multidimensional inventory of Black identity, which was created by Sellers and colleagues. There are also other measures such as the one by Finney, which looks at ethnic identity development, which you can use with folks that don't identify as Black or brown folks. It's been really good for Latinx individuals and other folks as well. And then we have a conversation around the scores. And as a part of that conversation, there are three activities that we do with the client based on what their scores are suggesting. The first one is something called the racial perception analysis, where we work with the client to do a compare and contrast of how society sees them as a person of color versus how they see themselves. We utilize what is called a racial trauma. We utilize what is called um, a racial identity genogram to explore the messages that have been communicated to them throughout their families. This is where we can help explore challenges related to colorism and certain expectations for folks based on lightness or darkness of their skin, hair texture, etc. And then we also engage the client in affirmation experiential activities to help support them as they learn and grow in their racial identity. So we spend a lot of time assessing, we spend a lot of time in experiential activities, with the goal being to help the client develop a more affirming sense of their racial identity.
Great. And what do you suggest when someone is living in a part of the country where there aren't enough options to find clinicians of color?
Yeah, so this is also on my website as well, but I'll talk about this idea of interviewing your clinician. And so we always have the ability as consumers to research the folks that are providing us our treatment. And so what that looks like is asking the client, asking the therapist, have you ever worked with someone like myself? How do you adapt your traditional way of doing things to people that look like me? Excuse me, what's been your success working with folks like myself? What challenges have you had? Excuse me, just asking questions that allow you to see if this is a good fit. Because you are right, there's less than 15% of us in the entire country identify as persons of color as clinicians, at least for psychologists. And so, because of that, it's important that you interview your therapist to ensure they're going to be able to provide you culturally competent care.
Great. We also have a lot of questions about a list of the inventories and scales and assessments that you've referenced throughout the presentation. That's something that if you could send a list of those to me, I can send that out in the follow-up email if that's something that people are interested in.
Sure.
All right, what else do we have? So switching gears a little bit, how can this research be applied to the many individuals being released from jail and in community programs where their trauma is being triggered daily?
Mm-hmm. Good question. So within our practice, we work with folks that are justice involved, and we highlight the ideal that for many Black and Brown folks, um, being involved in the criminal justice system is a form of trauma, and that trauma is connected to also the racial background. Because if we think about how over 60 or 70% of the people that are in prison right now are people of color, but we represent a significantly less number of the population. That there's something about one's racial background that is influencing that. That will also influence their differing experience of the criminal justice system and their ability to navigate that. And so we have the opportunity to have a conversation with them when we talk about how the criminal justice system has been a racially traumatic experience for them, which then allows us to utilize the model in a meaningful way.
Do you have any suggestions on a best approach in a crisis situation, for instance, in an emergency room with someone who's struggling with being triggered by racial trauma?
Yeah, so there are there are three things that you can do in this space. The first thing that you can do is you can acknowledge that the person is indeed experiencing racial trauma. You can inform in terms of providing them information about what it is that they're experiencing and why. And then you can like navigate. You can connect. That's the word I want to use. You can connect. So you can help folks to get access to information that can further explain the situation to them. There's a small, brief, cartoonish kind of webinar that I have about racial trauma. You can all where people can feel more believed in their experience. So acknowledge that what the person is experiencing might be due to racial trauma. You can inform them. You can provide them education about why they might be experiencing racial trauma, how they might encounter that. Then you can also connect them to resources such as the ones on my website and other folks perhaps in their area that have some training in racial trauma therapy.
Great. We have a question specific to substance use. Is there any evidence-based interventions to help clients come to terms with the racial trauma they've experienced and understand how that trauma can impact their ability to feel safe in the world and how that will impact their ability to recover from substance use?
So we talk about how we work with some folks that are experiencing issues related to substance use. And one of the things that we share with them and just kind of share with other folks as well is that substance use can be a coping strategy that people are using to deal perhaps with racial trauma. And so part of our work is helping to replace those coping strategies with more adaptive ones, and then also to help them to explore how racial trauma perhaps contributed to the use of the substances in the first place. And I found that to be a helpful way to at least work with folks that are experiencing those type of chronic issues.
Could you talk more about anger as a trauma response and if you see anger as a secondary emotion?
Sure, I for sure believe that anger is a secondary emotion. So whenever I say angry Black boys, I mean that kind of more of a funny sort of way, because I always see anger as the top of the emotion. And really, what these kids are experiencing are shame and guilt and anxiety and sadness that they're unable to express, either because it's not safe to do so or because society hasn't given them the perceived permission to express those type of emotions. And so when we're working with folks in the room that have experienced racial trauma, we of course want them to express that anger, because for many of them this is perhaps the first safe space where they can let out all the frustration connected to their experience of microaggressions and discrimination and other forms of difficulties that they've had based on their race. And after that anger has dissipated, then we could get to the other emotions that they've perhaps been unable to share because it's been so covered by that frustration and anger, in terms of that sadness, guilt, and shame, that we can also explore as part of the process. And that's really where we spend time during our racial trauma processing, is to uncover and unpack those other emotional experiences.
How can one convince a school district to implement trainings like this for their school district that are predominantly Black?
Sure. So I work with our school district here. It's called Jefferson County Public Schools. We have 14,000 teachers and instructors and staff, and then 100,000 students. And they've taken a three-pronged approach that hasn't cost them a great deal of resources, but I can see that's going to have a significant impact for them. So the first thing that they've done is they've provided training and education to their administrators. So they have an office of social emotional learning, and those folks have went through my racial trauma therapy training modules, and so are informed now in the ways in which racial trauma can impact folks, especially our youth. So their administration has a better racial trauma informed lens. The next thing that they did was they created modules for teachers that are virtual. You know, they're able to go onto a website, they're able to learn information about racial trauma, about microaggressions, about the different ways in which it impacts folks in a learning situation. So it's not designed to shame them or make them feel bad. It's just designed to provide information, but then also to give real-time examples, because there are role plays in there. There are things that they can see about how they can navigate situations differently. And the last piece is recognizing that our students are also impacted by this experience. There are modules specific for students as well, when they go into spaces and they're able to utilize these micro interventions for microaggressions and racial literacy skills that are a part of the modules that they're learning as well. So administration is getting trained, the teachers are getting trained via these modules, and the students are getting trained as well, both as Black and brown folks that have experienced the racial trauma, but then also the white students as well, um, to engage in that type of work. So that's the approach that JCPS has taken. And I think it's one that other schools can take as well.
Great. Is there any treatment or assistance for Black professionals trying to navigate the white workplace?
So probably a third of the folks that we see at the Collective Care Center right now are professionals navigating white spaces. We hold space for them all the time. We have a group. One of our groups is mostly for professionals that are navigating white collar jobs and the discrimination that they're experiencing there. We utilize the same type of approach. We just applied it to a group format. And so I would encourage you to think about that piece as well. We support folks on developing those micro interventions for microaggressions. We support folks on having conversations with other professionals within the group about how they've encountered and experienced the trauma. Um, and I found it to be really helpful for folks, because for many Black and brown folks that are in these spaces, they feel unheard, they feel unseen, and they also feel like they can't share their authentic selves, which might have some rage connected to it, because of what they're encountering in the workplace. And our group setting at least gives folks the space to be able to kind of let all that out.
Great. How does one navigate the trauma that happens at the intersection of marginalized identities, like Black women or LGBTQ plus Black folks? And can you also speak to gaslighting and how those experiences are minimized?
Sure. So we take an intersectional approach. We recognize that anybody that comes through our door, how they experience racial trauma will also be compounded by the other marginalized identities that they hold, and certainly welcome and hold space for that and for those experiences. And so, because you can't, none of us are just one identity. And that's actually one of the things that we're all fighting against when we're in these spaces, us marginalized folks, is to be seen for our whole selves. And that's the goal that we like to have for folks, is to be seen as their whole selves, however they choose to define that. When it comes to the gaslighting piece, we take a stance that we're here to sit and listen to your experience and not to discount it, not to deny it, and not to diminish it in any sort of way. Because our goal is to give you a corrective emotional experience when it comes to being in settings where you're oftentimes not believed and not heard. We want you to feel from the get-go that we are here to listen and to be of support to you. And so I'm hoping that that's what folks will experiencing. I know that that's what folks are experiencing when they spend time with us, and that helps us to address the gaslighting piece, and also all of those the racial trauma processing helps folks to feel heard and seen. And then the skills piece helps folks to create their own spaces for voice and choice um, to be seen out in their communities.
Great. All right, last few questions. A lot of the literature on trauma addresses trauma as a single event. So how does this approach take into account the continuity of racial trauma?
Sure. So that's why we do the third module because we recognize that trauma is ongoing. Uh, for at least the space of being able to teach the coping skill for at least the racial trauma processing piece, we focus on a singular event so we can then translate the process and the skill to other instances of trauma as well. We recognize that we recognize that everyone cannot experience what am I trying to say? So so everyone what am I trying to say? Oh, so we focus on the skill, we focus on the racial trauma processing, and we recognize that because everyone, 96% of Black individuals, and really for many persons of color, it's the same experience, will have ongoing experiences of daily discrimination, racism, which are all daily forms of racial trauma. And so by even having that kind of in the beginning of our conversation, and then also included at the end, allows us to maintain that perspective.
Great. And last question is a popular one. A lot of people wanting to learn more. Do you have any book recommendations for people to get more information on this topic?
Yeah. What are some good books out there? So I think my grandmother's hands is a good text to read. I think there's another book that I had on my head. I think that Dot of Chaos book is a good book. Um, I think checking out the website that has a lot of resources in it. The 400 Souls book. Yes, I just bought that. It's on my reading list. It's right over there. I'm pointing like you can see it, but it's over there. Those are all good texts to read. Anything by Dr. David Williams, anything by Dr. Joy DeGary, anything by Molife Asante, Naeem Akbar, Joseph White, like all those type of folks. Those are really good authors to check out.
Great. All right. And it's 3:15, so we'll wrap there. Thank you so much for a fantastic presentation. I've been in the chat the whole time, and it seems like so many people have taken away such great information from this. And thank you to everyone who joined us today. I'll be in touch with everyone in the next few days to get you that recording, the slides, and also that link again to request your certificate of attendance. Thank you, everyone, and enjoy the rest of your afternoon.